Over the last decade, the market's been flooded with breakthrough devices, each one promising a new standard of healing. Lasers, radial, ultrasound, and even some so-called shockwave devices. And yet, patients are still in pain. And providers are still searching for something that truly works. Because while some of these technologies have their place, they all fail to do the one thing that matters most: trigger real biological healing at the cellular level. So the question becomes, why do these technologies fall short? Well, it comes down to three critical areas: depth, power, and coverage. And understanding each area is the key to discovering the science behind StemWave and what truly makes it different. And by the end of this video, you'll know exactly why over 1,000 clinics, elite medical institutions, and championship athletic departments are all calling StemWave the only choice in regenerative care. So, let's get started with the first flaw: depth. See, most devices barely penetrate past the surface. They're simply not built to reach the deep musculoskeletal structures where chronic pain, degeneration, and inflammation actually live. Take lasers, for example. They work through something called photobiomodulation. It sounds complex, but it's basically just the process of light particles interacting with your cell's energy factories. It's like giving your mitochondria a gentle nudge to reduce inflammation and pain. But here's the problem: photon energy drops fast with depth. Even high-powered lasers only reach about 2 to 3 centimeters deep. That's maybe okay for surface-level tendonitis, but when a patient comes in with bone-on-bone knee arthritis or deep shoulder dysfunction, that light never reaches the root cause of pain. Now, let's look at radial pressure waves. They perform a little deeper, roughly 3 to 5 centimeters. But the same limitations are still there. Their energy dissipates as it travels, creating a gentle vibration rather than a regenerative response. So when you're trying to target deep fascia, capsule layers, or periosteal tissue, it just can't reach them. The real pathology goes untouched, and that's why depth matters. Because if you can't reach the source, you can't heal the source. Now let's move over to our second point: power. Because depth alone isn't enough. Even if you could reach the right tissue, without sufficient energy, regeneration simply doesn't happen. See, true regenerative healing requires high peak pressures and ultra-fast rise times measured in nanoseconds to trigger biological healing at the cellular level. But most systems don't have the firepower to get there. Piezo and electromagnetic systems, for example, operate at roughly half the therapeutic energy needed to create those regenerative effects. They're precise, but underpowered. You might get a temporary increase in circulation, but not the cellular repair cascade that rebuilds tissue. Think of it this way: you're knocking on the cell's door, but never opening it. Because true regenerative healing requires power, lots of it. Which is why these systems may momentarily ease pain, but don't produce enough energy to activate the critical biological responses needed to achieve long-term regenerative outcomes. And this leads us to our final point, because even when a device does reach the right depth or generate enough power, most of them fall short in one final but critical area: coverage. So picture this. Let's say you're treating a shoulder. You've got inflammation in the bursa, degeneration on the supraspinatus, maybe even early arthritis in the capsule. But your device's focal point is the size of a pinhead, maybe 2 millimeters wide. So you spend 30 minutes dotting around, trying to cover the area inch by inch. It's going to take a long time for you to effectively treat the entire area, and more often than not, you're going to miss the critical areas of inflammation throughout each treatment. Now, some manufacturers have tried to solve this by widening the treatment field, making it broad and unfocused, but that's basic physics again. When you spread the energy too wide, intensity drops off exponentially. The inverse square law kicks in, and by the time it reaches the tissue, it loses significant therapeutic power. That's why results with these systems are inconsistent. They're missing the balance. They're missing the harmony between depth, power, and precision. And this is why clinics across the country are ditching lasers, radials, and unfocused shockwave systems and making the switch to StemWave. Because only StemWave was engineered to solve all three of these limitations at once. So, how does it actually work? Well, StemWave uses an electrohydraulic system to create an electrical spark underwater between two electrodes. The water superheats, splits at the molecular level, and forms a plasma bubble that explodes in under 10 nanoseconds. That explosion generates a focused shockwave traveling at over 3,500 miles per hour. These shockwaves move at supersonic speed, and reach up to 12 centimeters deep, which is 3 to 5 times deeper than most treatments, meaning it effectively reaches those complex musculoskeletal structures that most modalities simply can't. And when those waves reach the damaged area, they generate a variety of biological responses. First, they dramatically increase circulation. It does this by triggering vasodilation, which expands blood vessels and drives 3 to 4 times more blood to the treatment area, which leads to faster nutrient delivery, quicker pain relief, and accelerated healing. Second, StemWave modulates inflammation at the source, creating the ideal environment for tissue repair, long-term recovery, and cellular healing. And lastly, StemWave directly activates your body's natural regenerative abilities. It does this by mobilizing stem cells and growth factors to the damaged area, helping rebuild tissue and restore function at the cellular level. And what makes StemWave truly special is how precisely we engineered these waves. See, StemWave is the only shockwave system that introduces a proprietary advancement known as cellular response technology, or CRT for short. CRT enables StemWave to produce 10 times more therapeutic power than standard devices and delivers it through a precisely engineered therapeutic zone that's 2 to 3 times larger than most systems. It's not too narrow that it misses key coverage points, and it's not too broad that it loses precision and effectiveness. It's the perfect balance between power and precision, engineered to deliver full, consistent coverage over the entire treatment area. And that's why StemWave delivers what others can't: immediate relief, consistent outcomes, and true regenerative healing at the cellular level. And listen, this isn't just theory. We have the clinical data to back it all up. Clinics using StemWave routinely report up to 10 to 30% improvement after the very first 5 to 10 minute session. By the 4th or 5th visit, that number jumps up to 50%. And by the end of a full care plan, the average provider is reporting upwards of 80 to 95% improvement across the board, measured by reduction in pain, increase in range of motion, and functionality. And that's how the average StemWave provider adds $5,000 to $25,000 in new monthly collections within 60 days of using the device. And if that sounds like a stretch, it's not. We've done this in over 1,000 clinics with a 98% success rate across the board. Yes, an industry-leading 98% success rate. And that's only possible if you have an industry-leading technology. So, if you're comparing devices, remember, if depth is missing, the root cause of pain and inflammation never gets touched. If power is missing, regenerative healing never activates. And if coverage is missing, the results never become consistent. But StemWave gives you all three, which is why StemWave providers can promise immediate relief, day one results, and hope where everything else has failed. So if you're interested in learning more about the real-world applications of StemWave and how it can help your patients and your practice, I recommend watching our Impact series next. This is where we travel across the country and document the real-life stories of patients and clinics using StemWave. It's raw, it's emotional, and once you feel the impact of these videos, you'll understand why StemWave isn't just part of the future of care. It is the future of care. I'll see you on the next one.